Good morning. My name is Murrita Bolinger. I am the Chief Medical Officer of Copeland Health Systems. You already know that there are cases of COVID-19 in the state of West Virginia. I want to clarify a couple of things with you this morning. COVID-19 is also known as novel coronavirus, and people have been using the term coronavirus. Please know that there is also a coronavirus that is common every day, typically in common cold, and kids typically have that strain of coronavirus. We are talking about something new. I'm going to use the word COVID-19. Much is unknown about this new virus. We are learning from other countries, states, organizations, and also other counties within our own state. Copeland Health Systems is working with community partners, hospitals, ER, health department, state health department, and epidemiology, the study of diseases, to learn more how to protect our community, our patients, and our staff. Having said that, I want you to be aware of the situation at hand. Greater than 60 to 80% of those who become positive with COVID-19 will have few, mild, or no symptoms and will do well. 5%, however, will be critical. The median age of those that are affected is age 64. Having said that, we know by statistics that greater than 37% over the age of 51 to 70 and 37% greater than 70 will become positive for COVID-19. Those that are at risk for having a more serious complication of COVID-19 are those that have heart, lung, and diabetes. Those are the people that will have more serious illnesses with this. So what do you do as a community, as our patients? Well, prevention is still number one. We want to slow the spread of this virus. One thing we do know about COVID-19 is that it easily spreads. We know that it can last on surfaces between 2 hours and 9 days, and it depends on the surface, whether it's cardboard or whether it's plastic. The amazing thing is that we can do something about that, and that is disinfect and clean. Your common household disinfectants will kill this virus. The important thing that I want you to do is I want you to wash your hands, soap and water, 20 seconds. That's very important. In between your fingers, up to your wrist. Use hand sanitizer. The alcohol content in that hand sanitizer needs to be between 60 and 95%. Avoid touching your eyes, nose, and mouth. If you develop a cough, make sure you do very good cough etiquette. Cough into a tissue, into your elbow. Throw that tissue away in a lined trash can. Avoid contact with individuals who are sick. Social distancing, I'm sure you have heard that terminology quite a bit over the news media. Social distancing means sit or stand or talk 6 feet from an individual. What we know about coronavirus, COVID-19, is that it is spread by respiratory droplets. So when somebody coughs or sneezes, the weight of that droplet does not go past that 6 foot distancing. So it's an extra protection for you. When you are cleaning and disinfecting, remember to do your cell phones, your telephones, your computers, anything that you touch, doorknobs. If you are sick, stay home. If you have fever and cough, that does not mean you are automatically have coronavirus or COVID-19. Call before you seek medical attention. The reason for that is If you call and are concerned that you may have COVID-19 or that you have fever and cough, they will triage you or direct you to different parts of the building to help reduce lobby time, wait time, and get you in and out of the building as quickly as possible. This particular virus, the symptoms can last 2 to 14 days. That fever can come and go during that time frame. If you are isolated or quarantined, that means that it does not mean that you are positive for COVID-19, but it means that if you've been tested, that test is pending. We are waiting on results. If your symptoms become worse, you can seek medical attention at your primary provider's office or the ER if they become severely worse. The important thing is to call before you go. Call the office. If you feel your symptoms are that warrant 911, when you call 911, let them know that you are under investigation for COVID-19. Healthcare workers need to protect themselves to stay in this game longer. One of the things I want you to focus on is that 80% will do well. With this fever, it must be treated or should be treated with Tylenol. If you are positive for coronavirus, your provider may say, isolate yourself at home. Stay hydrated, rest. Treat your fever, body aches with Tylenol, and stay isolated for 14 days of symptom onset. And like I mentioned before, fever will come and go. You may or may not meet the criteria to be tested for COVID-19. Be aware of that. Trust your providers to make that determination. There is no scientific evidence about those individuals that do not have symptoms, and could they possibly carry it to others. That is part of this virus that we do not know. Copeland Health Systems is on the front lines to sort out and determine who should go to the hospital or the ER or stay home. Trust your primary provider to make that determination. Copeland Health Systems is following CDC guidelines to identify, isolate, and contain to help reduce the spread. We need to work together because what we're hoping to do is to flatten the peak of what we know that this virus has done in other countries. And we have a chance to flatten that peak if we follow these prevention measures, and especially the social distancing and hand washing is ever important. Presenting to the office is going to look different to you. It may be frustrating, all these changes that's happening in the medical system. It's frustrating for us as healthcare providers as well. When you enter buildings, there will be a screening process. You will notice that staff are wearing protective equipment. They will have a mask and possibly gowns or coats. They may be wearing goggles. It's for their protection because they're coming in contact with a lot of different people. The other thing that I want you to know is that Copeland Health Systems will be closing noon to 1 o'clock because we feel the cleaning process is very important to clean in between shifts. So we are ramping up our cleaning, disinfecting. We are increasing staff to cross-train in cleaning processes. I hope this is helpful information. The goal of this presentation is to reduce your fear. Please do not panic. Please take care of yourself and your families. If you have any questions, please call our offices. And we will be able to answer your questions and help reduce your fears. Thank you so much for your time.